Meghalaya Health Minister James P.K. Sangma on Monday announced the state draft mental health policy and named Meghalaya Mental Health and Social Care Policy. Announcing this on the occasion, he said that the policy is holistic in nature and focused on promotion of mental health. Working on collaborative work designs, emphasis will be laid on building safe spaces and first responder teams, focused to prevent and address stress and loneliness, early identification and care besides other aspects. He said that the policy was drafted by a committee headed by Health Secretary Sampath Kumar and a subcommittee that looked into the finer details of it and has been put in the public domain. Meanwhile, Mental Health Day was observed across the state in July. A program was organized at Darbar Shnong Minthong Community Hall. Psychiatrist and Nodal Officer DMHP Dr. A.N. Paswet highlighted the importance of creating awareness on mental health issues. In West Khasi Hills district, a program was organized at Mikofet Hall, Nongstoin, under the theme Make Mental Health and Well-Being for All a Global Priority. Speech on mental health was delivered by District Medical and Health Officer Dr. S.A. Lingdo and other experts. Prizes were also distributed to the winners of slogan competition and other events.
Today, because of the work put in by the subcommittees and by the committee, come up with a mental health policy which is very, very holistic in nature. In today's world, students, they live with a lot of stress in their lives. It's not just adults who are going through stress daily, but students undergo a lot of stress. And that's what this policy seeks to achieve, to look at how we can have that support system readily available for them.
The District Magistrate of